Good evening, ladies and gentlemen. My name is Gilda. Today I'm here to speak about a persuasive speech to inform about the good work of nurses. Most of us, we've been in places like hospital and nursing home. We have seen different people in different outfits like scrubs and white coats. But today I'm here to talk and appreciate the work of the people in scrub, and those are nurses. Nurses, they've been play a very huge role to our society and to our community. It's my honor to stand here today and to appreciate the nurses because they be a very good backbone to our patient and people we care in our daily life. To begin with this speech, I'm going to talk about the difficulties nurses are facing. We're going to see how the nurses are going through some difficulties in their career, and that is like the physical demand of their job. The nursing job, it has a huge demand of the physical well-being of a person. That means nurses are facing a huge part of standing up in long hours, being on their feet, moving up and down. Most of the activity they do, they're using on their feet, and that affects their physical well-being. Also, nurses been lifting and transporting patients from one place to another. That can be either by machine or by them use their own power, and that's real affect the nurses. So when we talk about the physical demand, we means nurse as a job, it require a very well-being person physically to handle, and that is, I can say, is one of the disadvantage because most of the job you don't use most of your physical ability. Another one is working hours. With the nursing career, I can say the working hours are challenging. They have to work a very long hours, sometimes 12-hour shift to 24-hour shift, and that's real affect their well-being of sleeping and to rest and to have times with your family. Sometimes work on night shift and very long hours. That's real affecting. Like I say, that is another disadvantage of BNS. But apart from that, there's so many good things of being a nurse and so many things that make nurse to be a nurse and to be a valued person. Another thing is to be undervalued. When we talk about undervalue, we see how they are not to be appreciated, how people they don't recognize what they do at that time. Most of the people they see, it's a job that it need a lot of sacrifice and a lot of things to be done, but they don't recognize that job, so they be undervalue these people. You can see people they can appreciate the doctor, the physician, because those are the main people they consider they can do better than the nurses, but in real life and actual life, the nurses are spend more time with the patient, and I don't say like they're better than the doctors, but they need to be understandable and they need to be valued as nurses because they play a big role part in this medical field. So let's see the good things the nurse does that make me say this speech today and make me to want them to be recognized as people in our society. One thing the nurse have the empathy, the ability to understand and to roll over with the patient's feelings. This is the most thing most people look when they're in the certain condition. Somebody to understand you, somebody to know who you are and to feel what you're going through at that right moment. And these are the nurses. They are being there with the patient, feel their pain, feel their empathy, and this is what I can say. It's a thing present the nurses who they are, and these are the things that they make nurses to work every day and to appreciate their work and what they do. The impulse to sympathize with their families, to sympathize in with the loved one, even when the loss is occurred. That is a good thing I can say with the nurses. So with that, people they have to value the actual work of the nurses because some patients they don't have family, they don't have anybody to talk to, they don't have any person they can share their feeling, what they go through. But through nurses, these people they be experience how they're feeling, and the nurses they be a very really backbone to understand them and to be with them. Another thing is problem solving. Nurses they can solve multiple problems even in under work pressure. We have see how they can do their passing medication, be patient counselor, be patient companion, and they can do all that just in 1 minute and they can bring a life to somebody. So when we talk about the importance of nurses, I want people to look at these people in a different eye, not like just a regular workers or regular career, but things that touch our society. Even now in this situation we have pandemic, we have seen them to be in the front line in how they work very hard to help people in this situation. So this is what I can say. Nurses they play a very big role in our society, and people have to appreciate them in one way or another because we need them today, tomorrow, and forever. Thank you.